In this video, we're going to talk about a newly FDA-approved treatment for postpartum depression called brexanolone. The brand name is Zulresso. It's basically a metabolite of progesterone, a hormone that your body makes that really skyrockets during pregnancy. There's both good news and bad news about the treatment of postpartum depression. If you stay to the end of this video, I'll let you in on a little-known secret about this new drug and an alternative that might be nearly as effective, but that has some major upsides. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. I love helping women in menopause with their hormone-related symptoms and the health risks that they may even not realize that they have. But I'm also interested in reaching patients at all stages of life and helping them understand how just right hormone levels can eliminate most or all of their symptoms and help them avoid long-term health risks at the same time. So what's the deal with postpartum depression? What are the symptoms? How long does postpartum depression last? Postpartum depression is a type of serious depression, often with a lot of anxiety attached with it, that happens after a woman gives birth to a baby. The symptoms are, of course, severe depression, a lack of interest in anything, trouble sleeping, suicidal thoughts, crying all the time, an inability to engage with family members or husband, just not being able to get out of bed in the morning, sometimes not even having the motivation or the willingness to get up and take care of a brand new baby. So there's a difference sort of quantitatively between what we might call baby blues or a feeling of sadness that might come over a new mom versus what's called postpartum depression. A new mom is bound to have some feelings of letdown and maybe discouragement. She'll most likely be exhausted physically and mentally. She'll be very likely to get just a few hours of sleep every single night because of that new baby, which only makes the exhaustion and the depression worse. She may have some natural anxiety about how that baby's doing and if everything's going to work out okay. She may worry, especially if it's her first baby, about every little sound or movement the baby makes, concerned that there's something wrong or that they've done something wrong. But those are just some things that new moms come to expect, and they sort of have to deal with those as best they can. Postpartum depression, though, reaches a whole different level. It goes beyond the first few days or even the first couple of weeks after the baby's born. It can even stretch out for months. So there's something inside the ovary called the corpus luteum. It's what's kind of left behind after ovulation, where the egg came from. The corpus luteum, the ovaries, the adrenal glands, and the placenta all make progesterone during pregnancy. Progesterone levels, because they're made in so many different parts of the body, go sky high during pregnancy, higher than at any other time in your life. High progesterone levels are really crucial for maintaining a healthy pregnancy, and women with low progesterone are actually at much higher risk for miscarriage. Progesterone is also partly responsible for morning sickness. It tends to cause a lot of nausea, especially at high doses. Progesterone is what's called metabolized or broken down into a hormone called allopregnanolone. Allopregnanolone is also very high during pregnancy just because there's so much progesterone around. Within just a few hours after giving birth, mom's progesterone and allopregnanolone levels drop like a rock. This makes women feel really sad. It can start within about 4 hours after the birth and might last for weeks or even months. The funny thing is that low progesterone levels and allopregnanolone are also very much related to the severe depression and anxiety that happens in menopause. I've surveyed over 2,500 women in menopause, and a whole lot of them complain to me of symptoms like depression that even makes them think of ending their lives. Anxiety so serious they can't walk outside to pick up the mail or take out the trash. Well, these are pretty much the same symptoms that new moms can experience in postpartum depression. If a woman in menopause is deprived of progesterone, which many, if not most, are, it causes severe depression. It causes anxiety, it causes insomnia, basically the same set of symptoms that postpartum women have. There's good news and bad news about postpartum depression. The good news is that there's a new drug that's been FDA approved in 2019 to treat postpartum depression. It's called brexanolone. Brand name is Zulresso, and it works pretty well. It's actually allopregnanolone, that metabolite of progesterone that I mentioned. Allopregnanolone seems to work pretty well in taking women from severely depressed back to feeling more like themselves and maybe able to go about their lives again, take care of their brand new baby. The bad news about allopregnanolone or brexanolone is that you can actually buy a brand new fully loaded Toyota Prius or a Ford F-150 for the cost of treatment with this new drug. That's right, this new drug costs around $34,000 for an IV infusion that has to be done in a hospital setting for a couple of days. That's 60 hours or basically 2.5 days. But take heart, oral micronized progesterone just may be able to do roughly the same thing as this incredibly expensive, incredibly inconvenient new drug. As I've mentioned, progesterone is metabolized to the same allopregnanolone that's found in the drug. It's likely that oral capsules, often referred to as oral micronized progesterone, are at least as effective and definitely less expensive as a way to raise your allopregnanolone levels. You don't have to go into a hospital to take oral progesterone capsules. They're way, way, way cheaper than the injectable brexanolone drug. They're available by prescription only, and you'll have to see a healthcare practitioner to get a prescription for progesterone capsules. So whether your OBGYN or your family practice doc would be willing to prescribe progesterone for postpartum depression, that's kind of a big question. Many doctors may not want to touch it, even though it's very safe. You might need to talk to a hormone optimization specialist to get somebody to take a look at your progesterone and your allopregnanolone. If you've had severe postpartum depression in the past, let's say with another baby, and you're concerned about it happening again with the next baby, talk to a healthcare provider about progesterone as a possible treatment. It's way less expensive than brexanolone, and you can take it in an oral capsule rather than an IV infusion. If you're a woman in menopause, maybe you're concerned about postpartum depression for your daughter, recognize that you're also at risk for the serious symptoms of progesterone and allopregnanolone deficiency. If you're interested in finding a hormone optimization specialist near you, somebody who can help with menopause or postpartum depression, I know a lot of them all over the country. I can't guarantee I can recommend somebody in your area, but I'll certainly give it my best shot. If you are a hormone optimization provider, a physician, a PA, or nurse practitioner who helps patients optimize their hormones, I'd love to add you to my growing provider database. That makes it easier for me to refer you to patients that need you, let's say to help them with menopause depression or maybe postpartum depression. If you found this video helpful, click the like and subscribe buttons to get notified whenever I post a new one. Thanks so much for watching, and we'll look forward to talking to you again soon.